University College of Pharmacy and Health Science presentation on the Bachelor's of Science in Health Sciences program. Tonight we'll be talking about not only our bachelor's program, but we'll also be talking about the pre-occupational therapy and the occupational therapy doctorate degree, and the pre-athletic training and the Master's of Science in Athletic Training degrees as well. I want to thank you all for joining us tonight. Looks like we've got quite a few participants. So for those of you who are listening and watching, we really appreciate you joining us tonight. And for those who may be watching this after the presentation, thank you so much for downloading and including us in your college search. Before we get started with the actual PowerPoint presentation, I would like to start off with a short video about our program. It's something that we have featured on our website, and so you may or may not have had a chance to view this if you've been visiting the College of Pharmacy and Health Sciences website. But we, I think our faculty and our students in the program actually say it best. That's something that we really pride ourselves in, is being able to showcase what our students are doing. I do realize that I forgot to introduce myself. I want to make sure I do that. My name is Jessica Lang. I'm the admissions liaison for the College of Pharmacy and Health Sciences. And here with me tonight is also my colleague, Evan Favreau from the Office of Admissions. And he will be kind of monitoring the comment box down below with your questions. So if at any point during the chat you have a question, please feel free to type it in the chat box. I'm going to do a quick test right now to see if you all can hear me. So if you can hear what's going on in the presentation so far, can you please type yes, or we hear you, or something in the chat box to indicate that you can hear me? We've got a couple people answering already. Fantastic. Thank you so much. All right, so now we'll start our video.
At Drake University in Des Moines, Iowa, students pursuing their Bachelor of Science in Health Sciences are able to choose an intellectually challenging path that matches their career interests.
Well, the Health Sciences program is a great degree for students that are interested in pursuing any kind of healthcare career, whether it be as a practitioner, as an administrator, or as a researcher. It provides a blend of interdisciplinary coursework as well as practical experiences.
As any science major will tell you, we have a very rigorous course load, and we have very high expectations placed upon us by our professors. But they're also very receptive, and they urge us to get involved on campus. And so I have worked very hard to have a meaningful personal life outside of my academic studies.
Drake offers an academic experience where students learn by working alongside faculty to apply their knowledge in the classroom, labs, and the community. Experiential learning is a vital part of a Drake education.
I have a great relationship with basically all the faculty members that I know. We can sit down and have conversations with all the faculty. They know us all by face and name, and I feel comfortable going up to any of them with any questions that I have. And
I think here at Drake, students have a unique opportunity to be involved in the labs, to do research with a faculty member and with other students within our college as well as outside of our college. To gain experience in the laboratory, not only using state-of-the-art equipment to answer questions, but more importantly to develop critical thinking skills that they can apply when they graduate.
Experiential learning is unique in the health sciences program at Drake University because we actually use 2 semesters of hands-on active learning for the students off campus or with researchers here on campus.
During my capstone experience, I'm actually placed in Broadlawn's Medical Center with a whole healthcare team in the mental health unit. So I'm working with physicians and physician's assistants and nurses and pharmacists hands-on, working as a team and individually. So I get to see the different roles in the actual facility, which is very unique. And after that experience, just seeing how they interacted and the responsibilities and roles of each career and how they differed really helped me decide which strengths I had and how it aligned with each of those careers and which one I could see myself succeeding in more than the other.
Health sciences students benefit from taking courses in other fields and working with students and faculty from different areas of campus, along with opportunities such as study abroad.
As a physician assistant, you have to work with your supervising physician, you have to work with the patients, you have to work with the nurses, support staff, the administrators. So I think if you're able to work with them early in life and you learn how to work with other people from different majors early in life, that's very beneficial.
The fondest memories I have are of my learning experiences outside the classroom. So one of them that stands out was I was able to do a 3-week study abroad seminar to Uganda. So it was sustainable development in sub-Saharan Africa. And so I, being public health oriented, was interested in the AIDS epidemic in Uganda. So that was a huge learning experience for me, and definitely opened up my eyes even wider, to public health on a global scale.
Thanks to thorough professional preparation during their time at Drake, many career and postgraduate options exist for health sciences students, including medical school, allied health fields, research pursuits, and health systems administration.
So for me, I spend time both in the clinic and in the lab. So at Drake, I learned, at least got started learning how to do both pretty early. So that experience is helpful every day. I mean, I use the skills I learned there on a daily basis.
I probably give so much credit to Drake for where I am today, just because I feel like I really grew within these walls. I just think that the opportunity that Drake really tries to bring to their students is just one of a kind. It's that individualized attention and support that we receive that really makes us stronger professionals. I'm just very thankful and blessed for the opportunity that Drake has given me, and through the name, through the real-world experiences we're given through our senior capstone, and even before that, my internships.
Pursue your dream of making a difference by exploring the health sciences degree at Drake University. For more information, go to our website or schedule a campus visit.
All right. So to begin talking about the health sciences program, I'd like to give you just a little bit of an overview on what the program actually entails. Our Bachelor's of Science in Health Sciences program is a 4-year bachelor's degree. Students in this program have a focus on preparing them for success in pretty much any healthcare related field they could possibly want to go into. Many of our students are bound for professional and graduate programs. Some examples of that might be medical school, physician assistant programs, some pursue physical therapy or dentistry. Some pursue more of an administrative or a public health type program if they're in Masters of Public Health or Health Administration programs. But we also have a fairly good number of students that go on and start a job or a career immediately after graduation. And so the nice thing about this degree program is that it allows you to have that flexibility while still giving you the preparation that you need to be successful in pretty much any pathway you would want to take, whether it is graduate or professional school or beginning a job right after graduation. We have a very interdisciplinary curriculum with our health sciences program. The majority of our students going through health sciences are either adding minors or concentrations to their program, or they're double majors. We have quite a few students who are double majoring in other areas of science, not just biology and chemistry, but also neuroscience, psychology, sometimes even environmental studies. We have quite a few students who do business minors or double majors with business. And we even have some students that have minors in the fine arts or humanities. A lot of people think that it may be tough to do, but here at Drake, it's actually quite possible and not very difficult to do a minor in music, for example, if you are a health sciences major. Many of our students have that artistic passion, and so we encourage them to explore that by adding it as a piece of their degree program. So you have a very wide variety of things that you can do with the program. And we'll talk a little bit more about some of the opportunities you have to add some of those minors, concentrations, some more value to your degree a little bit later on. But another piece of the interdisciplinary nature of our curriculum is that our students are actually taking courses throughout the entire university and not just in our college. Our students are taking courses in the health sciences, and of course that is the foundation of the program, but they're also taking courses in the natural sciences, which is from the College of Arts and Sciences. They're taking business courses out of the College of Business and Public Administration. Those that are going into more of a healthcare education role are taking courses in the School of Education. Those that are going into healthcare communication take courses in the School of Journalism. So it is very, very interdisciplinary in nature, in that the students are getting to know multiple disciplines. They are getting to know faculty from across the university, and they're taking courses with a wide variety of students as well to get multiple perspectives in their classes. The other thing about our program that I think makes us very unique is the fact that practical experiences, we call it experiential learning, is actually integrated throughout the program. Students start their practical experience in their very first semester. We offer a course series in health sciences called Issues in Health Sciences. And actually the first course that they will take in that series of 5, their first semester, it's called Issues 1, Connections and Careers. And in that Connections and Careers course, it's actually a career exploration course. Our students have the opportunity to explore some different areas of health sciences, do some shadowing at different practice sites, and just learn about the different pathways that are available to them. So we get you involved very, very early in getting out into practice sites, seeing what's out there as far as healthcare professions, what life might be like in the different professions, so that you can kind of see what you like, what you don't like, what you might be good at, what you want to do with your degree, what pathway do you want to take. And we want to start early so that you can make some really important decisions along the way and be knowledgeable when you're making them. Feel like you're very confident in the decisions that you're making. After that first semester, we start having you visit practice sites on a more regular basis. When you're shadowing during that first Issues in Health Sciences course, it may be just a few times for the semester. You'll typically visit each site once, and you might do that 2 or 3 times. So you won't be spending a whole lot of time at the sites, maybe just a few afternoons for the semester, or maybe a few days. But once you get past that Issues in Health Sciences 1 course, we actually have you start going to the practice sites on a regular basis. It could be every week, it could be every other week, but you're paired with a practitioner or some kind of healthcare professional, and you're actually going to their practice site. You are engaged in what they're doing. You're actually involved. You're no longer just observing or watching, shadowing. You're actually doing something at the practice site. So you're responsible for things. And I think that's very special. A lot of times when undergraduates in larger universities, or if they're in the natural sciences like biology and chemistry majors, if they want experience in a healthcare field, a lot of times they have to go look for it on their own and do a lot of hard legwork to find those experiences. And they get told no a lot. Or when they get told yes, all they're doing is sitting and watching. With our students, we have a lot of support here in the college to help you find those experiences, so you won't be on your own when you're going to look for shadowing or experiential learning or your internships or summer opportunities. We have an entire office that's dedicated to helping you find those experiences so that you can make the most of your time here at Drake. You're not being told no, or you're not just going and sitting and watching people. You're actually doing things at the site. You're involved in the practice. So I think that's very special. A little bit later on, when we talk about the different pathways within health sciences, we'll talk about something called the senior capstone. Every student at Drake in their last year of their bachelor's degree does something called the senior capstone, and it's an all-encompassing experience or project or something to tie your 4 years at Drake together. For our health sciences students, this is an experience. It's a semester, actually it's a full year long experience where you're out in a practice site and you're spending quite a bit of time. It could be anywhere from 15 to 25 hours at the site each week by the time you're a senior. So a good chunk of that senior year is spent in a practice site, actually working at the site. So very exciting things for our students in health sciences that really make our program stand out as far as what our students can do and what they have access to. We also have some opportunities in the program for success. We talked a little bit about the Issues in Health Sciences series. I want to talk a little bit about faculty advising. One of the very special things about Drake, and this is true for every major at Drake, not just health sciences, but every single student that comes to study at Drake has a faculty academic advisor, someone who teaches in their department, a professor in their field, acting as their academic advisor. For our health sciences students, this means that your academic advisor will be a professor in the College of Pharmacy and Health Sciences, someone who teaches in the health sciences program. And it kind of depends on what pathway you choose to who you're paired with for your advisor. If you are more interested in some of the rehabilitation sciences, maybe the physical therapy or the occupational therapy route, athletic training, sports medicine, maybe it's art therapy or music therapy. We have faculty in areas of the rehabilitation sciences that can advise you and guide you through that pathway. If you're more interested in maybe medical school or research, maybe the pharmaceutical sciences, things like that, we have faculty that have a level of expertise in those areas to help you along the way. They are really great mentors. Our faculty are here at Drake to teach, and that's not just in the classroom, that's in every aspect of where they spend their time here at Drake. When you're in the classroom, you'll always have a professor present. We do not have TAs that teach our classes here at Drake. You will always have a professor in your classroom with you. When you're in the lab, same thing. We even have some faculty who work in a practice site along with the teaching responsibilities that they have here at Drake. And anytime a faculty member is out at a practice site working, they have students with them. So you actually get to see our faculty in more than just the classroom capacity. You get to see them out in the field as well, which is extremely beneficial for our students to see people that they have in the classroom and that are mentors for them and that they build professional relationships with in more than one aspect of their job. Very exciting. Another teaching and learning opportunity for our faculty includes that academic advising. Anytime a faculty member sits down with a student for an advising appointment, they see that as a teaching and learning opportunity. So it's a very good way to start building professional relationships as an undergraduate student. And since all of our faculty members have some kind of expertise in healthcare, different areas of healthcare, you're getting that mentoring relationship, that advising relationship from someone in the field that you're interested in. You don't have to wait until you go to medical school or PA school or start your first job to build a relationship with a professional in healthcare. You get that immediately from day one. So it's very, very exciting for our students to have that advising and mentoring relationship. The only other one on this screen that we really haven't talked about yet is the Office of Academic and Student Affairs. We have a centralized office here in our college that takes care of all of our student affairs and academic needs. Anything from if you have a class that you've taken in high school that you'd like to use as transfer credits. Maybe you took a class through your community college or local university. Our office takes care of all of those requests. If it's maybe changing the time of your lab, or if you want to add a minor or a concentration, our office is completely dedicated to things like that. So helping you with those daily operational tasks can be very helpful for you. That way you can maximize the time that you're spending with your faculty advisor and treating that more like a mentoring relationship. I think that's how we really support students in the best way possible. So you've got a lot of resources out there to help you in your success here at Drake University. And I think that makes our health sciences program very, very unique and extremely an extremely good preparation for our students who want to go into careers in healthcare. Tonight we're going to talk about a few different tracks and pathways. The two tracks that we have in the program are the Clinical and Applied Sciences track and the Health Services Management track. And if you're looking at the slide, you can see that those are the top two pictures above there. The pre-professional programs there at the bottom include our pre-occupational therapy and our pre-athletic training programs. And those are both pre-professional programs that are connected to advanced degrees. The occupational therapy degree is a doctorate degree, and the athletic training is a master's degree. And so we'll talk about all of these components in a little bit more detail, but I wanted to give you kind of an overview of the options that you have while studying health sciences here at Drake. The first track I want to talk about is the Clinical and Applied Sciences track. Now, of the two official tracks in the health sciences program, clinical and applied sciences is a little bit larger. This is a great preparation for students who want to go into some kind of practitioner or patient care related role. Many of our students in this area go on to professional programs. They're studying to become nurse practitioners, physician assistants, they're future chiropractors, optometrists, dentists, physicians. Lots of opportunities there for students to become successful in getting into their top choice programs there. But we also have students that are in the clinical and applied sciences that start careers in the allied healthcare professions as well. A lot of these folks are in more of an assisting role. They may be medical assistants or surgical assistants. A lot of them tend to be technicians or technologists, maybe working in medical imaging or radiology. Some of our students might be working in different capacities within helping around a clinic or around the hospital with patient care, taking patients' vital signs, maintaining patient records. Pardon me. Excuse me. So there are a lot of opportunities there for the students in this clinical and applied sciences track to either go on to professional programs or begin their career immediately after graduating. There's a very strong focus on science within the clinical and applied sciences curriculum. You'll be taking a lot of biology, a lot of chemistry. With some of the programs that students might be applying to for professional programs, they might require physics or anatomy and physiology. You may be taking things like kinesiology, biostatistics. There's a little bit of math in there with calculus. So if you like the math, the science aspect of healthcare, this might be a great track for you to pursue. It gives you all of the requirements that you need in order to get into your top choice medical school or professional program. This track also has a lot of those clinical experiences. Earlier I talked a little bit about the experiential piece and how it begins with shadowing in the Issues in Health Sciences 1 course, and it increases in the amount of time and the amount of engagement that you'll find throughout the program, so that by the time you are a senior and you're doing your capstone, you're paired with a practitioner in your field of study, and you get a very good sense of what it's like to be in that setting, in that office, or in that hospital, and how a professional in that setting really lives their life on a daily basis, what they do at work, what happens when they see patients, and when they're just doing their daily responsibilities around the office. So it's a very exciting place to be for our students who are interested in having more of that patient contact. If you're a person who really wants to be, I like to call these people the face of healthcare, because as a patient, when I go in to see my doctor, or I work with a nurse, or I'm seeing, my optometrist or something like that, that's the person that I'm seeing. That's the person that's providing the care for me. And so that's a fantastic way to prepare yourself for professional programs or careers down the line. The second track that I want to talk about is our Health Services Management track. This is a little bit smaller than the Clinical and Applied Sciences track, but this is also for students who really want to have a great impact on healthcare, but not necessarily in the out front working with patients aspect. I like to call these the behind the scenes folks. The Health Services Management students are our future hospital administrators. They're future clinical office managers. They could be working in the records department to maintain accurate patient records. They could be working in communications between different healthcare organizations. Many of them go into a public health career, or maybe administrative career. So these are more of the folks that maybe don't want as much direct patient care, but are still very, very important to how a healthcare organization runs. These are the people that are helping things run smoothly behind the scenes, so that the experience we get as patients is meaningful, is really providing the best service possible. Some of our students go on into graduate programs in the healthcare industry. Many of them start careers right after graduation. So again, this is a great option for our students, regardless of what pathway you decide to choose. Pardon me. The emphasis in the health services management program is a little bit more focused on the business and administration piece, a little bit of marketing. As a student in this program, you actually are very, very close to getting a business minor if you choose health services management. If you are a student who is maybe on the fence a little bit between whether or not you're going to go into health sciences or business, you actually can do both here at Drake. If you take a couple of your elective courses with the health sciences program and take them in the College of Business, you actually are only 2 or 3 courses away from earning a minor in business with your health sciences curriculum. Most of the courses that are required for a business minor are already included in the requirements for the health sciences major in the health services management track. So an excellent opportunity for you if you're a more business-minded person. You like that administrative side of healthcare. The capstone on this side is a little bit more comparable to what we would think of as a traditional internship in an office setting, because these folks work a lot more behind the scenes. They have a little bit less contact with patients, but a much bigger impact on the operational side of the healthcare industry. We have 2 pre-professional programs that are starting this fall, well, I should say next fall, fall of 2016. You may have heard about our pre-pharmacy program that's been established for quite a while here at Drake, and we actually did a prep talk on that last week, so if you have the opportunity and you're interested, you're welcome to download the pre-pharmacy prep talk or contact us for more information. The 2 pre-professional programs that I'm going to talk about tonight are our pre-occupational therapy program, along with the doctorate degree in occupational therapy, and the pre-professional athletic training program, along with the master's degree in athletic training. Students in both of these pre-professional programs are earning their bachelor's of science in health sciences. We call these the accelerated programs. The reason they're called accelerated is because it actually takes you less time to complete both of your degrees here at Drake than it would if you started at Drake and went to another program for the professional side of it, or if you started your undergraduate coursework somewhere else and then came to Drake for the professional degrees. If you do all of it here at Drake, it typically takes you less time to do it. And we'll talk a little bit about the timeline for the occupational therapy and the athletic training piece individually. But one of the things that you'll get in both of these programs is something that we call the Drake difference. If you have been inquiring about pre-pharmacy at all, you may have heard us call this the Drake PharmD difference. Well, we're extending that Drake difference to include our occupational therapy and our athletic training students. The main thing that we really want students to understand with the Drake difference is that with that difference, you're getting full consideration for admission into the professional program. This means that you are automatically considered for an interview into the professional program. All of our professional programs require an interview in order to move from the pre-professional side up to the professional level. And so as a pre-professional student in pre-pharmacy, pre-OT, and pre-AT, you are automatically going to get that interview. You don't have to worry about being invited to have an interview. A lot of students that apply to the program and are not starting at Drake, or maybe they're not starting in the pre-professional programs at Drake, maybe they're doing a biology or a chemistry major, they don't get automatically invited to interview. As a matter of fact, this year we have some students that are applying to our pharmacy program, and I expect this will be the case in the future when we are interviewing OT and AT students, that we will have some students from outside of the university who meet the requirements in their GPA and their test scores, but they're not invited to interview for the professional program. So it's really a great advantage to do pre-OT or pre-AT or even pre-pharmacy here at Drake with the intent of going into our professional programs, because you get that added benefit of being guaranteed to have an interview. With that, I want to talk a little bit about the 2 pre-professional programs individually. The first one is occupational therapy, and I want to begin the occupational therapy talk with a short video. It's not very long, but I think this video was produced by the American Occupational Therapy Association. It's actually a student production. Each year, the AOTA, which is American Occupational Therapy Association, does a contest for student videos to promote the profession. And I think this one is a very, very good representation of what occupational therapy is. A lot of times I field questions from students and families about what it exactly is occupational therapy. A lot of people like to compare it to physical therapy, and actually they're related. They're both in the rehabilitation sciences aspect of healthcare, but to be honest, occupational therapy is a lot different than physical therapy, and I'm not sure how many people actually realize that. So we're going to watch this short video, and then after the video, we'll do a little bit more explanation on what exactly occupational therapy is and why a student might want to pursue it as a career option.
We all have life goals, things we need and want to do. Sometimes things get in the way of our goals. Life events can make our goals seem impossible.
I love gardening, but it's difficult because I have arthritis.
I want to drive my car, but I couldn't after my stroke.
I need to find a job, but it's been challenging since being diagnosed with schizophrenia.
I want to make new friends, but it's hard because I have autism.
I need to get dressed in the morning, but I just had a hip replacement and can't bend forward.
I have difficulty managing my responsibilities because of my anxiety disorder.
I haven't been able to ride my bicycle since I had a brain injury.
I need to do my grocery shopping, but it's difficult to remember when I have dementia.
It's tough to care for my baby because of my carpal tunnel syndrome.
I need to walk my dog, but I have multiple sclerosis.
I want to learn the guitar, but my right arm is amputated.
I had a spinal cord injury, but I want to live on my own. My occupational therapist helped me to achieve this goal.
Occupational therapists help people to find the tools and strategies they need to overcome barriers such as illness and disability and reach their goals.
Now I live on my own.
I'm learning the guitar.
I can walk my dog.
I can care for my baby again.
I am able to do my grocery shopping on my own.
I can ride my new special bike.
I am working on managing my responsibilities.
Now I can dress myself.
I'm making new friends.
I'm working with my OT to find the right job for me.
My OT helped me to drive again.
I have a garden now.
Because of occupational therapy,
I can!
All right. I see that some of you are typing questions in the chat box. Thank you very much for that. I want to save a little bit of time at the very end to go through some of your questions. So I'm glad that you're typing them. That way we remember them, because I definitely don't want to lose those. But at the end of the presentation, we'll be checking the chat box to see what questions we have and make sure that we hit all of them. So thank you very much, Lauren, for getting us started. So we just watched a video on what occupational therapy actually is. The main pieces of occupational therapy that are most important for students to remember is that occupational therapy is really helping people live life to the fullest, helping people accomplish their dreams. When I talk to students about occupational therapy, a lot of times people are under the impression that the word occupation refers to people's jobs, and so an occupational therapist would be someone who goes to your job to, maybe help you rearrange your workspace, or figure out how to make yourself more productive or something like that. Some occupational therapists do that. but that's not the only thing that an occupational therapist can do. Other times I've heard that, maybe an occupational therapist might be someone who can help me find a job. Well, some occupational therapists do that, but not every occupational therapist does it. They do much more than that. The word occupation actually means daily activities. What are the things that we do on a regular basis, every day, every week? What are our routines? What are the things that make us independent? Those are the occupations that we have in our lives. You saw from the video things like getting dressed in the morning, or driving a car, or walking the dog, going grocery shopping. Those are all occupations that we have. So occupations is actually much broader than a lot of people think. And an occupational therapist works with patients or clients or people in general over every age span, from birth to being little children to an aging population and the elderly. Occupational therapists work with everyone to help you live your life to the fullest, to help you achieve your dreams. It's increasing your independence, helping you engage in your daily living activities. Perhaps it could be helping you with adaptive equipment. You can see in some of the pictures on the presentation, we've got some adaptive equipment in these pictures. The young lady who's painting does not have her right hand. Her right hand was amputated. So an occupational therapist helped her to develop a piece of adaptive equipment that she could use to maintain control of her paintbrush. So there are lots of opportunities as an occupational therapist for creativity, for just the opportunity to make a difference in people's lives, I think, is the biggest thing. This is also one of the career pathways in the healthcare industry that is projected to grow at an exponential rate. Over the next 10 years, we're projecting that occupational therapy job opportunities will grow almost 30%, which is huge. There are not very many professions, not just in healthcare, but any profession that is growing at that rate of speed over the next 10 years. So as a future occupational therapist, the outlook for having a job after you graduate with your doctorate degree is extremely high, and definitely something that if you're interested in the rehabilitation sciences, that you might consider going into. So very good opportunities there for occupational therapy. So occupational therapy at Drake, again, is accelerated with what we call the Drake difference. These students do earn their bachelor's degree. It's a bachelor's of science in health sciences, which is why I'm talking about it during our health sciences presentation, because that's the bachelor's degree that these students earn. You have the option to earn that bachelor's degree in either an accelerated 3-year period, which is a little more aggressive, and it does take some individual planning, but if you, depending on your personal needs, if you would like to do that bachelor's degree in 3 years, you do have the opportunity to do it. Otherwise, you can choose to complete the bachelor's degree in the traditional 4 years that most students would complete it. There's that full consideration for admission into the professional program, that guaranteed interview. The other piece of the full consideration for OT students is that as a student who's completing your bachelor's degree, you don't have to take the graduate record examination, the GRE, which is the common admission test for graduate and professional programs. Our students under the Drake difference don't take that. Rather than have you take the GRE, we're going to use your courses in your health sciences degree to determine your strength as an applicant. We can get the exact same information about you from looking at the courses that you're taking at Drake as we can from having you take an expensive test. So rather than have you take that test and spend all that time and money on that test, we would rather have you focus on your experience as a student. Studying for courses, doing well in those courses, getting experience out in the practice sites, making the most of your time at Drake. And we can tell whether or not you're a strong candidate by how you do here at Drake, what experiences you take advantage of, and how well you do in your classes. So we don't need you to take that test. So that's part of the full consideration for the Doctorate of Occupational Therapy program. Once you're admitted into the Occupational Therapy Doctorate program, it's a 3-year degree program, and students go to school year-round in that doctorate degree, which is an accelerated piece. Most occupational therapy doctorate programs around the country, and there are not that many, I think at this time there are only 7 or 8 in the country, a few schools are turning their master's programs into doctorate programs, but there are by and large few occupational therapy doctorate programs out there. A lot of those programs are 4-year programs. So a student would spend 4 years getting a bachelor's degree and then 4 years in a doctorate program for a total of 8 years in school. Our students have the opportunity, if they do the 3-year bachelor's degree, they're doing a bachelor's degree in 3 and a doctorate degree in 3 for a total of 6, shaving off 2 years of the time that you would normally spend. Even if you're doing the 4-year bachelor's degree, you're spending 4 years during the bachelor's and 3 years in the doctorate program, which is a total of 7 years. So even if that taking a little bit longer to do that bachelor's degree, you're still accelerating the process. You're still shaving some time off of the total time that you normally would spend in school. Great way to get a jump start on your professional aspirations if OT is something that you're interested in. And in order to get that Drake difference, you do need to be a pre-OT student. The application process for pre-occupational therapy is not different than the application process for the general university. You would fill out the exact same application. You can fill out either the Drake application or the common application. You're still listing pre-occupational therapy as your major. We admit on a rolling admission basis, so there's the opportunity to find out fairly soon after you apply. I think Evan may want to correct me on this, but I think it's anywhere from 4 to 6 weeks after you apply that you typically find out your admission. So the process works fairly fast as far as admission is concerned. With athletic training is a new program as well. We are actually beginning our pre-athletic training in the fall of 2016. So the pre-occupational therapy and the pre-athletic training will start at the same time. Students in this program who aspire to be athletic trainers will ultimately get their Master's of Science in Athletic Training degree, and you'll spend 5 years in the program. On the next slide, we'll talk a little bit about the breakdown of how those 5 years look. But an athletic trainer is typically someone who works primarily with athletes, but they don't necessarily have to work with athletes. There are plenty of athletic trainers who work with everyday people like you and me on their health and wellness goals. But it's someone who can take a look at different types of injuries and illnesses that athletes and people who engage in physical exercise are more prone to getting. These folks are specially trained to help diagnose and treat those illnesses. They're also have an expertise in therapeutic exercise, so using things like cardiovascular exercise, strength training, flexibility, stretching to actually enhance an athlete's performance. They're what we call first responders in a lot of instances, whether it's on the field or on the court. It could be in the gym. They're the person who can provide immediate care to whoever is doing the physical exercise and may get injured, whether it's an athlete or just an everyday person who's exercising. If the injury is serious enough, they can provide that care while an ambulance is on its way or before the person gets to the hospital. But even in the less serious injuries, the athletic trainer can provide some treatments for that as well. So they are kind of an expert in treatment, rehabilitation, reconditioning, anything that would have to do with an injury or an illness related to physical activity. Pre-athletic training at Drake works much like the pre-occupational therapy. Again, it's accelerated with the Drake PharmD difference. Our students start in the health sciences program, and they do earn that Bachelor's of Science in Health Sciences degree. For the first 3 years that you're at Drake, you're actually an undergraduate student in health sciences, and you're going through the Bachelor's of Health Sciences program. You're doing the curriculum for health sciences, but you're also doing the required coursework to get into the master's program as well. Again, you get that full consideration with having a guaranteed interview. The GRE is the typical test for the athletic training master's degree. Our pre-AT students do not take that GRE, so you have the opportunity there, again, to focus your energy more on your studies, doing well academically, participating in those practical experiences that you'll get throughout your time in the program so that you can become a strong candidate for us. We have a lot of confidence in our students in both the pre OT and the pre-AT program, just like we have a lot of confidence in our students in the pre-pharmacy program. Our pre-professional students, we expect that these students will be some of our strongest candidates for their doctorate and their master's programs. So even though they haven't started yet at Drake, 2016 will be the first year for them, we have very high expectations of these students, and we really think that they will be our cream of the crop for the doctorate and the master's programs when the time comes for them to apply. During that third year at Drake, you actually apply to your master's program. So you're applying to the master's while you're a junior here at Drake. Once you're admitted, you actually begin the master's degree program during your fourth year, what would be your senior year. At the end of that senior year, you do earn your bachelor's degree, so that by the time you earn your bachelor's degree, you only have 1 year of master's degree coursework left. So at the end of that fifth year, you'll have both a bachelor's degree and a master's degree. Again, this is more accelerated than a lot of other programs. There are many athletic training programs out there that require bachelor's degrees before you even get into the master's program, which means a student would have to complete a 4-year bachelor's degree and then do a 2-year master's program for a total of 6 years. The Drake athletic program, athletic training program, is a 5-year program, so it's a little more accelerated than what a typical program that you might encounter would be. I mentioned early in the presentation that we talk a little bit more about adding some value to what you're doing in your health sciences program. We talked about adding a minor or a concentration. Some of the concentrations that we offer include a global and comparative public health concentration. And this does not just have to be for students who are interested in going the public health route. You know, it is important for you, if you are interested in pursuing a master's in public health, that you have that background. But knowing how medicine and healthcare and treatment work in other countries and other cultures can actually be very beneficial, even if you're going the practitioner route. You know, if you're going to medical school, or if you're going to become a PA or a physical therapist, you're going to be working with people from all over the world, many, many different cultures. It could even be in a small town, you'll be working with many cultures. So it's important to have some knowledge about how healthcare works and how it's viewed in other parts of the world. Knowing where your patients are coming from can really add to your practice, and it can add to the trust that your patients have in you as an experienced and competent healthcare professional. So that global and comparative public health concentration can really be beneficial for anyone in the program, not just our students who want to go on to masters in public health programs. I kind of mentioned that we have students who minor in both the sciences and the non-sciences, even the fine arts. You can also do what we call a leadership concentration if you have aspirations of becoming a leader within healthcare. And many of our students do become leaders in their industry once they graduate from Drake. Having that leadership concentration is a fantastic way to enhance your practice as well. We have a lot of opportunities for organizations and involvement. If you have the opportunity to take advantage of those, which you will in the health sciences program, I highly encourage you to take advantage of it. You can actually join some of the professional organizations in the different healthcare industries as a student. We work very closely with the Iowa chapters of the not just the Iowa Pharmacy Association and the Iowa Occupational Therapy Association, but the associations that are related to being a physician, being a nurse, being a physical therapist. They all have chapters for Iowa, and all of those Iowa chapters are here in Des Moines, the capital city. So you have some great opportunities there to become engaged with some organizations and some professional development. We also have opportunities for research. If you have an interest, not just in what we would typically think of as benchtop research, where you are, working with chemicals and pipettes and wearing a lab coat, but even research, maybe in more of an administrative role or in the rehabilitation sciences. We've got some great research facilities that our faculty and our students are using to conduct some very powerful projects. International experience is also something that you can have here at Drake as a health sciences student. A lot of times when I talk to students who are interested in health sciences, they are under the impression that you can't study abroad if you're in healthcare. There's just not enough time. You've got too much to do, you've got too many requirements, and you can't take the time to go somewhere and study, to go to a different country. There are even some schools out there that right out tell students, you won't have time to do this. We don't allow our students to do this. At Drake, you can do it. And it's not that difficult. We actually have a process in place where a student could go away for a full semester to study abroad and come back and be right on track to pick up where they left off and not lose any time in what they're doing. It's something that we feel is very important to our student success. It's something that no matter what area of healthcare you go into, you have the opportunity to enhance your practice if you go abroad. It really contributes to your cultural understanding and how to communicate with patients from different backgrounds. So we see study abroad as something that's very valuable to our students' education, and those who want to take advantage of it, we help you make sure that that can happen and that we keep you on schedule to graduate on time. So it's something we take very seriously here at Drake. Being in the city of Des Moines is also a big benefit to you. You know, whether you're from a larger city or a smaller town, I think the benefits of being in Des Moines span kind of the whole range of where people come from. When you come from a larger city and you come to a town like Des Moines, I like to call us the small city with the big city feel. We are a kind of a close-knit community, especially in healthcare. The Des Moines healthcare professionals or healthcare professionals who work here in the metro area, they all know each other and they all work very well together. And it's a small world out there in healthcare. But that's great for you because when you make a good impression on the healthcare professionals that you'll be working with in the health sciences program, word about that spreads and people start to want you to come to their practices and do internships with them and provide experiential learning for you. So that's a very good thing, I think, to be that close-knit community. If you're from a smaller town, one of the things that I love about Des Moines is the size. You know, it's fairly big. It's the largest city here in Iowa, and you know, we have a lot of opportunities for you to grow as a professional, also as a student, just as a person. The opportunities in Des Moines to just engage with the community are fantastic, with not just in healthcare, but in entertainment. If you're an outdoors person, we have a lot to do outdoors, even in the wintertime. So it's a fantastic opportunity for you. Being the capital city, there are actually a lot of opportunities to be involved in healthcare at the core of the state. Any decision that happens in healthcare in Iowa happens in Des Moines first. And so our students are a part of that. We actually have some opportunities to send students to the Capitol for legislative internships regarding healthcare. So there are some opportunities there for you to get involved in policy and legislation as well. So if you have that policy bone in your body and you really want to be involved in legislative opportunities, you can do that here at Drake. I talked a little bit about the state associations, Iowa Pharmacy Association, Iowa Occupational Therapy Association, the different associations for the different professions, all are here in the Des Moines area at the state level. And then you also have the opportunity to work in a variety of different settings. We've got some very urban settings here in the Des Moines area. So if you want to work more in a city environment, you know, with populations that are kind of in the middle of a city, you have a lot of opportunity to do that in some varying degrees. But if you're more interested in working maybe in a smaller town, a rural environment, maybe a population of people that don't necessarily have the same access to people that in the city might have, there's an opportunity for you to do that as well. The rural areas of Iowa are not very far from Des Moines. And so it's a great opportunity to get to see both types of healthcare and the way that professionals work in both areas. So some great opportunities for Des Moines as well. With that being said, you know, I really think that the difference is in Drake with what we offer for our health sciences students in both the clinical and applied sciences and the health services management tracks, with our pre-professional programs in occupational therapy and athletic training and pre-pharmacy. We have a lot to offer students, and we really do pride ourselves in producing professional, prepared, students that are ready to take on leadership and make a difference in healthcare to really improve the lives of their patients. So if you're looking for a place that will help you become the type of professional that makes that difference, then I really encourage you to look into Drake and apply to Drake. So with that, we'll spend the last few minutes here taking your questions. The last slide up is my contact information, so you're welcome to write that down. If you think of more questions after the presentation, please feel free to email me or give us a call. I'm always happy to answer questions. Let's take our first one. So Lauren is asking about being able to pursue a career in physical therapy and whether or not a student would study in kinesiology or health sciences. You know, there are merits to doing both. And, you know, I think our new kinesiology program here at Drake is a fantastic option. The one thing I will say about health sciences that makes us an extremely good option for any profession within healthcare, including physical therapy, is the balance that you get between the sciences and education in healthcare. There are very few undergraduates out there that go into a healthcare profession that actually learn about the healthcare system before they get into their professional program. Many students who go on to medical school or physical therapy school or optometry school or whatever the case may be, they don't learn about healthcare systems. They don't have the opportunity to do shadowing until they actually get into those professional programs. Our health sciences students have the opportunity to learn about those, and it's actually part of your curriculum to learn about those aspects of healthcare before you even get into a professional program. So you're getting the best of both worlds with that, I think. And like I said, our kinesiology department is great, but in the health sciences, you are guaranteed to have that healthcare focused education so that it enhances your, and it actually makes you more prepared for those professional program opportunities. You come in a little bit ahead of classmates that may not have had that opportunity before coming into their professional program. We do have a couple more questions here. Let's take a look at what we have. One of the questions is, do we have medical school advisors available? All of our faculty actually participate in a graduate admission process here at Drake. Since we do have our own professional PharmD program and now beginning our professional occupational therapy program, all of our faculty participate in that graduate program. So they're all very, very knowledgeable about what it takes to get into a graduate and professional program. For medical school specifically, we actually have here on campus what's called the pre-medical committee, which is made up of faculty from our college, the College of Pharmacy and Health Sciences, as well as faculty from the Natural Sciences and the College of Arts and Sciences. And these are the faculty that specialize in helping students through the admission process to medical school. When you're looking for example for a reference or a recommendation letter, these are the faculty that typically provide those letters. And our students take classes with them. These are the faculty that teach in the biology classes and the chemistry classes and the health sciences classes that you'll be taking at Drake. So their specialty area is helping students be successful in that medical school application process. So if you're interested in going on to medical school after you graduate with your bachelor's degree, health sciences is actually a very good place to be because our faculty are very knowledgeable about the admission process to schools like that. And you also have an entire committee of faculty that's dedicated to helping you through those admission processes. You also have access to myself and my colleagues here in the Office of Academic and Student Affairs. Since we actually run the admission process for pharmacy and occupational therapy, we are very knowledgeable about what it takes to get into medical school and other professional programs. So you're always welcome if you're a health sciences student looking to go to medical school or any other professional program, you're always welcome to come in and bounce ideas off of us. You know, show us your personal statement, have us, you know, help you with your resume or figure out what the application process should be. There are a lot of resources here at Drake to help you through that process, which is why our students that do go on to medical school are extremely successful. I think the last statistic we have from last year on medical school admission, our students had about an 80 to 85% acceptance rate into medical school. And that's well above the national average. Medical school is very definitely competitive. And so the national average for acceptance is much lower than what our students are. So excellent question. Great.
Carrie Thompson was asking about, she's totally undecided. If she comes in this undecided, then how, through that process, how does she get into, like, how does she choose to do OT or AT?
I see a question here from Carrie. Carrie asks about being undecided in what you would like to do or what you'd like to practice, and how that translates into being a health sciences major. What kinds of support do we provide for students that may be on the fence on what they want to do? Carrie, that's a great question. One of the best things about our health sciences program is that Issues in Health Sciences series that students can take advantage of, and that is part of your curriculum. In the Issues in Health Sciences 1 course, the course that does the career exploration and that gets you started looking at the different pathways, we have plenty of students every year that come in completely undecided on what they want to do. They just want some help figuring out what is out there for them. You know, they might be trying to figure out between a few different professions that they have an interest in, or they might be interested in it all and not really know where to start. That's where the Issues in Health Sciences series is really going to come in handy. It's really going to help you kind of focus your education and figure out what you like, what you don't like. Sometimes figuring out what you don't like is way more beneficial and way more helpful than figuring out what you do like. So with the shadowing experience that you'll get through that Issues in Health Sciences course, the guest speakers that we'll bring in, the projects that you'll be doing on the different pathways, you will definitely get a very good grasp of what's out there for healthcare professions. And you'll get to have the opportunity to go out into those professions and see yourself in them. You know, can I see myself being a physician? Can I see myself being a nurse practitioner? You know, what are the things that I like to do? What are the things I'm good at? And you'll do a lot of self-exploration and a lot of career exploration in that, which is why I think health sciences, for anyone interested in going into healthcare, doesn't matter what area of healthcare you want, health sciences is definitely one of the best routes to go here at Drake. Oh man, we had a lot of questions.
I've answered a few of them.
I know that Evan's been answering a few of the questions in the chat box, so I want to make sure I'm not doubling up on things that he's been answering.
Stephen asked about any specific radiology or imaging clinical shadowing experience.
We had a student asking about any type of specific experiential opportunities related to medical imaging or radiology. One of the things that we have available is some opportunities to work with professionals in the different hospitals in different areas, so you can actually see radiology in action. I will be honest with you, I'm not an expert in all of the experiential opportunities that we have through the university. I know that we have quite a few, especially here in the Des Moines area at the local hospitals and clinics. I can tell you that medical imaging and radiology is a part of that. Beyond that, I'd have to do a little bit more research with our experiential office to find out exactly what those look like. If you do have a question about specific opportunities that you're interested in pursuing and you'd like to know if we partner with any of those, you are welcome to send me an email, and I would be more than happy to communicate with you individually on the opportunities that you're interested in and get back to you with some more detailed information from our Office of Experiential Learning. Great question. All right. It looks to me like, as I'm scrolling through some of the questions, it looks to me like we've either addressed all of them through the chat or through the presentation, or that Evan's addressed them in the chat. So we're just coming up, it's a little bit after 8 o'clock, so we've been here for a little bit over an hour. But I do want to thank you all for joining us. Again, if you do think of other questions tonight or later on that you didn't have a chance to ask or maybe thought of after the fact, please give us a call or shoot me an email. I am always happy to talk with students directly about their questions, about what we can offer in the program and what you can experience. And I really want to thank you for taking some time tonight to join us and having this time with us tonight. It's great to see so many students interested in Drake and interested in careers in healthcare, and the fact that you would take time out of your time with family tonight to join us. So thank you very much. I look forward to seeing all of you here on campus. Hopefully you're getting to Drake to visit us, so you can see us actually in person and our facilities and what we have to offer. And if you haven't had the chance yet, I encourage you to visit our admission website and schedule a visit, because that's the best way to find out about college, is just to get out there and visit colleges. Figure out what you like and what you don't like. It's all about figuring out what's right for you. So thank you very much. Enjoy the rest of your evening, and let us know if you have questions.